Good afternoon. My name is Adrian Dix, Minister of Health for British Columbia. Beside me is Dr. Bonnie Henry, BC's Provincial Health Officer. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and Esquimalt First Nations. Before we begin, just want to express our deep sense of condolence and grief to the people of Nova Scotia and to all the families involved in the terrible murders that occurred there. It's anyone who has had anything like that close to their family knows what it means to people, the grief people are feeling today and will feel for a long time, and we just wanted to express our solidarity with them. In terms of briefings this week, there'll be briefings Monday, Tuesday, Wednesday, and Thursday, all at 3 o'clock with Dr. Henry and me. On Friday, there'll be a written statement at 3 o'clock with information about progress on issues on that day. And then on Saturday at noon, Dr. Henry will be briefing. And with that, I'd like to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So we are updating on 2 reporting periods today, April 18th to 19th and then 19th to midday today. So for our first period from Saturday to Sunday, we had 29 new cases test positive here in British Columbia. And in the past 24 hours, we've had an additional 23 people. So that brings our total up to 1,699 people who've tested positive for COVID-19 here in British Columbia. And our total new cases since our last report on Saturday is 52. That includes 700 people in Vancouver Coastal Health Region, 705 in the Fraser Health Region, 102 in the Vancouver Island Health Region, 153 now in the Interior Health Region, and 39 people in Northern Health. In terms of outbreaks, we have one new facility outbreak, a long-term care facility, Chartwell Willow Long-Term Care. We now have, that brings us up to 20 long-term care or assisted living facility outbreaks and one in an acute care center with 307 cases associated with those outbreaks. We have a number of resolved outbreaks, including one at the Delta View Long-Term Care Home in Fraser Health and the outbreak we had at the Okanagan Corrections Center, the Provincial Corrections Center in the Interior, where we had just a single case identified, and we've gone through the incubation period with no further cases being identified there. The other outbreaks that we've been following, there's no change to the agricultural center outbreak in the Interior. We are now up to 75 people with COVID-19 associated with the Mission Federal Institution, including 64 inmates. In addition, we've now come to understand that there has been transmission to people who have come back to BC associated with the Kearl Lake project in Alberta, that's north of Fort McMurray. We have 7 people that we've identified directly related to that, and additional people are ongoing and being tested. And we know from our colleagues in Alberta that an ongoing outbreak investigation is happening in that community, and there's concerns about people who may have traveled to other provinces as well as here to British Columbia. And right now, I am ordering anybody who has been in the Kearl Lake project since March 15th and has returned to British Columbia that they must self-isolate for 14 days after their return. For many people, this will mean their return was over 14 days ago. If they had symptoms during that period of time or they continue to have symptoms, we want you to connect with 811 and tell us about that. As well, anybody who has returned in the past 2 weeks must continue to self-isolate until the incubation period has passed. And if you do develop any symptoms, then again to call 811, to call your healthcare provider or your local public health office so that we can have you assessed and tested if need be. We recognize as well that some people who were in Alberta and have returned and had some illness may have family members who are now suffering from some illness related to COVID-19. If that is the case, then we again would like you to call 811 so that we can assist you in being assessed and understanding if this indeed is COVID-19. Both Interior Health and Northern Health have had individuals who've come back and tested positive from the outbreak in Kearl Lake, and they are doing contact tracing and have identified all of the close contacts of those individuals that we know about at this point. We expect there will be more people. We know that there is people coming back and forth between places in Alberta and here on a regular basis as part of the essential work that they do. We also want to remind people that we have fairly extensive guidance in place for these types of camps and industrial settings here in British Columbia, and we are continuing to ensure that the guidance that we have provided to make these camps as safe as possible and to identify anybody who might have illness as early as possible, that these guidelines are being followed closely. In terms of the cases we have in British Columbia, we have 104 people who are now in hospital, and of those, 49 remain in critical care or ICU. On a sadder note, we've had 5 additional deaths in the past 2 days, 3 on Saturday and 2 yesterday, bringing our total to 86 people who have died from COVID-19 here in British Columbia, and our hearts go out to their families. We have as well 1,039 people who have now fully recovered from COVID-19. There's a number of things that have been in the works over the last few weeks, and I want to talk about a few of them right now. One, the announcement earlier today of our Rural, Remote and Indigenous Support Strategy, that the framework that has been underway for some weeks, but the Premier announced this framework today, and it is welcomed by us as a way to recognize and proactively support our communities that may have had limited access to the level of healthcare that we find in the larger urban areas. It enables us to provide more on-site testing and faster access to both to testing and to primary and urgent care and other supports, and to coordinate that effort and response across the province. And very particularly, it is one of the things that we are doing. It forwards the important work we're doing together on reconciliation, recognizing that our First Nations and Indigenous peoples in BC come from a place where they have not had as much of the supports that we've had in other parts of our society here. And they have been severely affected in past pandemics in British Columbia, in Canada, and around the world. So this is an important step to making sure that we put in the appropriate extra supports they need, and particularly to focus on protection of our elders in our First Nations communities, recognizing the vital role that they play in maintaining culture and language in many communities around the province. Additionally, I wanted to talk again about our testing strategy. As you know, and as I've mentioned a couple of times in the last few days, we evolve our testing strategy based on our changing situation here in British Columbia. And early on, we had a very broad testing strategy, testing particularly returning travelers, and making sure we were very sensitive about finding anybody who might have the disease here in BC. Plus, we had a community testing strategy based on our influenza surveillance network. When we started to get more community spread, we transitioned our testing strategy to focus on the highest risk and most vulnerable areas, so particularly outbreaks, those who are critically ill or needed hospitalization, healthcare workers, and people in our long-term care. We're now using testing again, and as of about 10 days ago, to help us quickly identify and address any new community cases and outbreaks. And for example, picking up the cases of people who had returned from places like Alberta. We want to avoid another spike in community cases, and that's why we are changing the strategy again to open it up and ensure that we continue to find everybody who needs to be isolated and where we need to do contact tracing in the province. So right now, anyone with symptoms of COVID-19 can now be assessed and tested either through your family physician if you have, your nurse practitioner, or a local community collection center. And you can call 811 to find out where those are. While everyone can get tested, not everyone needs to get tested, and that's very important. If you do not have symptoms, this test has very limited benefit and is not necessarily valid. So it is for anybody who has symptoms now of COVID-19, so cough, fever, shortness of breath, those are the things that we're concerned about. Or if you've had contact with somebody who you know has COVID-19 or has been associated with one of the outbreaks that we know. So now's the time where we've broadened again our testing so we have a better idea of anyone in our community who may have COVID-19 going forward. And this, of course, is part of our strategy for where we are going to go as we continue to bend and flatten and stop the transmission in our community. And there's been many questions about how things are going to change and when. And we are not yet through this storm. We must remain vigilant, and our testing strategy is part of that. We can only make those changes that we want and need to do when we have a sustained downward trend in people who are getting sick with COVID-19 in our province. And as we've said, we are not expecting any changes in April, and if we look at the trajectory and the modeling that we presented, we're looking at the middle of May if things continue to go the way that they have been going. We've been learning from other jurisdictions, and we've been doing a lot of thinking about what this will look like and how we can do it in a measured way that gives us that bit of space between opening things up and finding a new normal to get us through the next few months versus opening things too fast and having people come together and getting exponential spread of this virus in the province. So our new normal for the next coming months will still have restrictions. Restrictions on numbers of people who go to weddings, to funerals, regular religious observances and gatherings, restrictions on things like concerts and festivals and parade, and on travel, both within BC and beyond. We will continue to require everyone to follow orders, including our gatherings, and as we've talked about, having gatherings as small as possible. The order says no more than 50, but that's only if you can maintain those physical distances between people and you have the other appropriate things in place to prevent opportunities for transmission. Keeping our distance from our elders and seniors and those who are more vulnerable to severe illness from COVID-19 will continue to be essential. Avoiding non-essential travel, although we want to make sure that we have opportunities to connect with our families, our friends, our support networks in a way that we're not doing right now when we're still in the middle of the storm. Absolutely being incredibly sensitive to staying home and staying away from others if we have any sort of illness at all. It's self-isolation as we need. We need to think about how we can manage our businesses, how we can manage opening things up within those parameters, and how the essential businesses are operating today is a model that we can think about for going forward. And businesses, different sectors need to start thinking about that now. How can you continue your business in a modified way? And it may be hybrids for the coming time. Things, particularly making sure that anybody who is ill is not coming into your business, including your employees. Physical distancing, maintaining our safe distance from each other. Limiting workers and customers and the numbers of people on site. Using technology to work in the ways that we've learned in the last few months. And ensuring you have enhanced hand hygiene, enhanced cleaning abilities. Our new normal is going to be a modification of the things that we have had in place for the last few months. We also need to recognize that it's going to be trial and error and a challenge for us to find that important sweet spot where we can maintain some connections without putting ourselves and our community and our health system at risk. So we will be talking more about this in the coming weeks and coming up with plans together to get us through this next phase of our outbreak, our pandemic. We now, though, must continue to hold our line. I understand the hardships and the sacrifices that we have all made in the past 6 weeks, and we have to ensure that we don't let up too soon and waste all of that important work that we have done together. So I want to thank everybody for what you have been doing and what we will continue to do together, and to remind you to be kind, and when doing this, to be calm and to be safe.
Thank you very much, Dr. Henry. And first of all, I want to join Dr. Henry in expressing our condolences to all of the families, the caregivers, the friends of the 3 people who passed away from Saturday to Sunday, the 2 people who passed away from Sunday to Monday from COVID-19 in British Columbia. This is such a difficult time for everybody, but it is even more difficult time for that group of people, and we're thinking of you and understanding your grief, I think. And as well, we want to express our condolences and our thoughts, because while there is always in these presentations some news that is positive and other news that is not, no presentation can be seen as positive when it involves people who lose their lives. And we are with you, and we're thinking about you today. Dr. Henry has talked about the 1,699 people who have tested positive since January for COVID-19 in British Columbia. In hospital, that's 104 people, 52 in Fraser Health and 11 in Interior Health, 6 on Vancouver Island, 3 in the Northern Health Authority, and 32 in Vancouver Coastal Health. I wanted to acknowledge all of the work that has been done by public servants, especially in BC, in supporting self-isolation for people returning to BC from international travel or coming to BC from international travel. That's 137 people who are currently housed in provincial supported quarantine in BC. In that group of people, and thousands more who are being supported in their own self-isolation. We want to recognize their work. If you think of the 104 people currently in hospital in BC, there are also 4,309 empty beds in British Columbia that are available at the moment. That's a 61.3% capacity, so that's filled right now. So that gives you a sense that it's slightly more than last week of people who are in hospital. But in critical care units, that's 45.3%. We continue to have the ability to serve people. I wanted to note that we had 3,548 911 calls yesterday. That's down from the March 9th period when it was about 6,500, but it's also up from a week or so ago. And well, people having to call 911 is never good news. It's important for everybody to recognize that the health system remains available to you. If you need to call 911 for whatever reason, you can. If you need to visit an emergency room, you can in BC. And there are outstanding health professionals there who will assist you. It's important we recognize in this time that people are struggling with other things than COVID-19. I wanted to acknowledge all of the health professionals who have re-registered. That's 71 physicians, 1,245 people in nursing, from registered nurses to nurse practitioners to LPNs to registered psychiatric nurses to care aides who've re-registered in this time, and we so appreciate and recognize the service. There has been and is continuing concern and interest in personal protection and personal protective equipment such as masks. We continue to receive a significant amount of PPE from international sources, but as you're seeing from the international media and from the national media in Canada and from other jurisdictions, it's a real challenge to source PPE. We're receiving PPE from vendors and manufacturers that we haven't had a previous relationship with in the past. It's an absolute necessity that we make sure that the PPE we source is safe and effective before it makes its way into our healthcare system. Any alternative product or donated product that we receive goes through a process led by experts to ensure it's safe. We check to ensure that the product has appropriate certification and documentation. We check the equivalency of the product against the National Institute of Occupational Safety standards that we use in Canada. We manually inspect the product for tears and irregularities. For N95 respirators, we test the seal and fit of the mask. And if we're unsure of any of these steps I just mentioned, we send the mask away for laboratory testing to confirm that filtration and fluid resistance are suitable for use. In addition to that due diligence, we are committed to engaging with unions and stakeholders and healthcare workers before any alternative product is introduced into the system. We want to be absolutely certain that PPE is safe and effective, and importantly, that healthcare workers are educated and feel safe in the product before we ask them to use it. I need to be clear that we're approaching that point where we'll need to introduce alternative PPE. Our healthcare workers have done a great job extending use and conserving the product that we typically use in our health system, but it is running low. Like other jurisdictions, we're struggling to replace our traditional products in the context of all of this global demand, but safe and effective alternatives exist. Use of alternative and equivalent PPE are on the horizon, likely within the next week. And that's why I wanted to be clear about the standards that are being employed in British Columbia before such products are used anywhere in the healthcare system. I want to say finally just how pleased that I was and we are about what was announced by the Premier today. It recognizes the demands and concerns in Indigenous communities. It recognizes the demands and concerns of rural and remote communities, ensures that people get access to care and can get access to the acute care services they need when they need them, even if that means temporarily relocating near an acute care hospital, near hospitals that have the appropriate ventilators and the appropriate level of care. And I think that what has been announced today is a reflection of our ongoing commitment to ensuring that people everywhere in BC get access to the care that they need. And finally, just to reiterate what Dr. Henry has said, on Friday we presented modeling. On March 27th we presented modeling. And that's because we want all of you to know what we know, what our considerations are, so that we all can work together for the best possible result for people in BC. There's going to be a change in the amount in the types of questions we receive. There is already in the messages that I get on email and the contacts of people with me, change from discussing the pandemic and cases and circumstances to how can we open up type questions, or what about this game or this industry or whatever. And what's going to happen over the next couple of weeks is we're going to continue to do the work and follow the science, led by Dr. Henry, led by Deputy Minister Stephen Brown on the health side, and led by an effort across all of government, from the Premier to all Deputy Ministers to all levels of government, to follow the science, to make the best possible results, and to establish, I think, into the future, because it's going to be a significant length of time before we provide a vaccine, rules and directions and guidelines that will help people operate. It will be, in many cases, the responsibility of people to follow those, the responsibility of government sometimes to enforce, but the responsibility of people to follow those and to ensure what they're doing is safe, that it doesn't lead to new spikes and new transmissions. That's vitally important. That's the work we're doing now, and we'll be back to you with more modeling and more guidelines and proposals and protocols at the beginning of May. So I know people are anxious to ask those kind of specific questions, but the answer you're going to get is very similar to what Dr. Henry just said with respect to this. And I think, but I think this is the work that has to be done. We have to follow the science. And secondly, we have to stay 100% all in, because all of this depends, all of it, on us continuing to flatten the curve, continuing to reduce the number of cases, continuing to do what we need to do to ensure that those we love don't get sick. There's a case, as you know, in Alberta of one plant which has 358 cases of COVID-19. In a community, High River, Alberta, which has, I believe, approximately 13,000 people, about the size of Dawson Creek. This can come, and we need to be careful, all the time careful and vigilant and committed to one another, committed to the ones we love, committed to the ones we don't know, continue the people that we're yet to know but hope to know in our lives. We have to stay committed to one another and stay 100% all in ensuring that we flatten the curve, that we ensure that we together fight this fight against COVID-19 and ensure that people in BC have the best possible result. Thank you very much. I will say just a few words in French. Aujourd'hui, Nous faisons le point sur le nombre de nouveaux cas pour 2 périodes de référence de 24 heures chacune, soit celle du 28 à 19 avril, 18 à 19 avril et celle de 19 avril jusqu'à 20 avril en mi-journée. Nous sommes attristés d'annoncer 5 nouveaux décès liés au COVID-19, dont 3 dans la première période de référence et 2 depuis hier, pour un total de 86 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches. Je voudrais dire finalement qu'il faut qu'on continue tous d'être à fond dans la bataille contre le COVID-19 et we're ready to take your questions.
Thank you. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to 1 question. And please unmute your phones. You will not be audible until we call your name. First question is from David Molko, CTV. Go ahead, David.
Hi, Dr. Henry. Talking about opening up in this new normal and hybrid models and technology, we've got supermarkets that are starting to introduce temperature screening outside. Can I get your thoughts, your concerns, your advice on this? Should we be seeing more of it?
Yeah, I don't actually feel that temperature screening is particularly helpful. We know that with this virus, people can have very mild symptoms. About 2/3 of people to 3/4 have a fever at some point, but not having a fever doesn't mean that you're necessarily safe. You can have other symptoms that might be indicative of being sick. The most important thing is for people to recognize and to stay away if they're not feeling at all unwell. And that's a sensitivity that we're going to have until we have that point where this virus is no longer able to infect lots of people in our community, and that's either for people getting sick over time or a vaccine. So we're talking about the next year. We're not talking about necessarily forever, although these are some of the good practices that I hope come out of this for a long time. So we need to have a very, very, very low threshold for being able to stay away from others, not going out if we're feeling unwell, even if we think it's just allergies right now. That's when you need to stay home and let it settle down.
Next question is from Marcella Bernardo, News 1130.
Thank you, everyone. Just wanted to ask if it's possible to, I'm still getting requests from people or comments from people that they don't believe that everything that's being done right now is necessary, that they want to return to their lives and they feel that their rights are being infringed upon. How can we stress the importance of this any more than you already have when it comes to the importance of trying to explain to people they need to follow these rules as long as any more cases are being recorded? And just a quick note to Adrian Dix, happy birthday, by the way.
We won't tell you how we celebrated, but no. Yeah, it is important, and we've been appealing to the better angels of our nature for the last several months, and I know it's hard for people. It's a challenge when we may not know somebody who's had this. We may not actually have somebody who's in a long-term care home. So it doesn't necessarily touch us personally. But we have to trust and look at our communities, think about our families, think about the seniors and elders in our life in particular. And we need to look around at what's happening around the world, because we have averted a major crisis in our province, and it's because people have done what we have asked them to do. And what I'm asking you to do is to continue doing that for the next few weeks. And then we will be able to change, and we'll be able to do it in a way that is thoughtful and the way that allows us all to continue to be safe. And that is what we need to do as a community to get through this together. If we start having, and part of it is, and I look at what's happening in some places in the US, and it's that anxiety and that fear, and it manifests in different ways for people. So we need to continue to come together. We need to support each other to get through this part, even as it has become more and more challenging in these weeks. The numbers are going down, but we are not immune. We are still having outbreaks in our communities across the province. We are having imported cases. We are having people who are passing it on to their family and friends. What is different right now is when a few months ago, even a few weeks ago, when people were coming back from a cruise ship, for example, where they might have been exposed, they were going out and doing things and exposing 70, 80, 100 people, and that meant public health had to find all those people, and that's where we got transmission in our community. And it's not that people did this intentionally. It's because this virus is insidious. It can spread to others when you're not even realizing that you're sick yourself. So we can't let our guard down yet. There will be a time when we can do this. But right now, it's very important for us to stay the course. And when we're only having small numbers of contacts, it means we can control it. And it's not going to get that exponential growth that we've seen devastate communities in Italy, in parts of the United States, in New York City, in China. So this is our time to be patient and to continue together.
Tanya Fletcher, CBC.
There, I'm wondering if you can talk about looking ahead. Are summer camps and or daycares expected to be open this summer, and in what format? And if not, how would parents be expected to work outside the home if businesses do start to reopen and people are being brought back onto work sites, for example?
Yeah, so I can't tell you exactly what it's going to look like, but I will tell you those are the things that we're asking and we're talking to people about. And I expect it'll be some sort of hybrid. There may be some older children, for example, may not go back to school. They might continue virtual classrooms. But we do need, for younger children, some way for them to be safe during the day so that parents can go back to work. But it may be some hybrid as well, where some children are in classes certain days and others are in other days, so that we're able to maintain some physical distancing and safe ways of doing this. These are all things that we're looking at right now, looking at what's the best models for childcare to support our early childhood educators as well as parents and children. And it may be that, parents may go back to work on a reduced schedule or a changed schedule that supports their ability to look after their kids on a modified schedule. These are all things that we're learning as we go. We're looking at what people are doing in other countries, particularly around childcare and schooling. What we're thinking of, particularly in the coming months before summer, is there ways that we can trial certain different methods of doing this and see which ones work for the educators, for our teachers, early childhood educators, the educational assistants, as well as for families and for children. So expect to see in the coming months, sometime in May, different ways of doing these. And we're having those conversations with the school districts, with the child care programs and public health, and the superintendents, the ministries, about trying to find these innovative ways that we can safely care for children, safely get people going again in our communities, and learn from it as we go.
Lindsay Kynes, Times Colonist.
Hi, thanks for taking my question. The City of Victoria passed a motion last week asking the province to use its emergency powers to requisition hotel and motel rooms for people without homes currently living in tent cities. I'm wondering what you think of that strategy and whether you'll adopt it.
Yeah, and I've had some correspondence with the City of Victoria myself, and have been working very closely with the Chief Medical Health Officer for Island Health around some of these strategies. What I will tell you is that all of government has been looking at how do we address these issues across the province in a systematic, planned, coordinated way. And that's what I've been pushing. As I've said many times, we have two emergencies that we are dealing with. And the one, our overdose crises, has been compounded in many ways, particularly for people who are homeless and underhoused, people who have substance use disorders. It has been compounded by the restrictions that we've put in place to deal with the pandemic. So what we are working on, and what you'll hear more about in the coming days, is a coordinated plan that provides the housing that is needed for those who need it, and provides some strategy to support people who are dealing with and suffering under both of these crises that we're dealing with now.
Rob Shaw, Vancouver Sun.
Oh, hi, Dr. Henry. I realize you're still working on guidelines and protocols on businesses, but the third largest private sector employer in BC is the restaurant and hospitality sector, and I think they're wondering if is there any scenario where you would consider it safe for them to reopen or begin reopening dining room service next month? If you push the tables apart, you put an emphasis on more outdoor seating and patios and that type of thing, or does that kind of trouble you, the idea of those contacts and people being together in that way?
Part of it is my own personal desire to go back to my favorite restaurants, but I think there are ways, and what I'm putting out there is we need to be able to maintain those decreased connections. So not getting together in large groups where we know it can be a risk, both spreading it to each other and risk to staff in a restaurant, for example. So, but there's lots of innovative ways that people can get around that, and we've seen some of that with the takeout services. So yes, I do think there's options. It's not going to be back to what we were before, unfortunately, for a time. This is not forever. This is for the foreseeable months, certainly this summer, and then we'll have to think again about things into the fall as the influenza and respiratory virus season starts, and we may need to rethink some things. But I think there's lots of innovative ways that we can have in restaurant dining that protects both the staff as well as people who are coming in. And I'm looking to industry to come up with those ideas of how this could work. It's going to be a challenge, I understand, for many, particularly small restaurants in the coming months.
Mary Brooke, West Shore Voice.
Hi, thanks for taking my question. That's really good news to hear that you're opening up the testing to anyone who now wants to get tested. But I'm wondering if you have a particular message to grocery and pharmacy retail workers who are particularly stressed right now. I can already recount several situations where personnel at checkouts are not just stressed, but they're scared and they're openly saying so. And some are saying the plastic shields are not enough protection and that they feel shortchanged by their employers who aren't giving them enough direction.
I'm sorry to hear that, because actually, you know, the types of things that are really good protection are having a piece of plastic. You know, the plexiglass barrier between me and you is the way that we stop droplets from going between us. So it is actually a very effective method. And it's one of the you know, we talk about the hierarchy of infection prevention and control measures, and that's an engineering control. It's one of those things that's built in there that protects you. So I would reassure people that that is one of the simplest and most effective things we can do to prevent transmission. So that is, you know, that is reassuring. I will also say that, you know, testing has always been available for workers who are sick. So it is about people having symptoms. You know, it doesn't help to test people who are perfectly well. And so we need to make sure the things that we know make a difference, that do protect us from transmission of this virus, are maintaining that safe distance, having barriers, cleaning our hands regularly, not touching our face, and staying away from others when we're sick. Those things work, and we've shown that they work by what you can see in the data with the decreasing numbers of cases. What we see in even situations like our long-term care homes, when we put barriers between people and it doesn't transmit the virus. So that's things like wearing masks in the healthcare setting. That protects others from my droplets. So I would reassure people who are working in retail that the things that you have in place are the things that are going to protect you from this.
Next question is from Amanda Hosgood, the Tyee.
Hi, Dr. Henry. A week ago, you mentioned a rapid test similar to the Spartan test that would be going out to remote communities, maybe within the next week or so. I'm wondering if you have an update on that.
Yeah, so this is a Gene Expert. It's a machine that can be used in a, it doesn't have to be at the major laboratories, so it can be used in more remote communities, and we do have a number of those that have been pre-deployed to some of our smaller communities to make turnaround time more rapid. So it's the same swab that we use, an NP, we call it, a nasopharyngeal swab or a throat swab, but it doesn't have to travel as far, because right now they have to send them either back down to the Lower Mainland or to Kelowna Arizona for testing. So those have been deployed into the north, and we are ramping up the numbers of tests that can be done. And part of the transportation strategy that was announced today was to be able to increase the turnaround time or decrease the turnaround time by making sure that those samples can get to that laboratory much quicker.
Jane Side, North Shore News.
Hello, Dr. Henry. My question is about long-term care facilities, especially some of the long-term care facilities that were at the start of the outbreaks here in BC, starting in March. I'm hearing anecdotal reports that the situation in some of these care facilities, like the Lynn Valley one, is actually beginning to stabilize at this point, and that the people who were sick, the ones who survived, they've recovered. I'm wondering what you can tell us about the situation in the long-term care homes.
Yeah, well, there's been a couple of them that have actually been taken off the list because there's been no new cases for 2 incubation periods. The Lynn Valley Care Home, being the first one, has still had a trickle of cases, but as you say, most people have recovered now. We've tragically, of course, had 20 deaths in that facility, but most people have recovered, including some really great stories of people who've recovered. There have continued to be 1 or 2 cases, so it's not yet at the point where it's over, but I agree with you, it's certainly stabilized, and the same with Harrow Park, which is the other really large one. Many of our outbreaks were caught early enough that they have a very small number of cases, but there are still some where there's actively monitoring, because we wait 2 whole incubation periods before we say it's over. But I think all of the effort that's gone on in those homes has certainly stabilized the situation, and people are getting the care that they need.
Jeff Andreas, Radio NL.
Yeah, I was actually just wondering what kind of advice you might give to people who are looking to, maybe plan some leisure activities for the summer. Say I'm trying to, plan a trip to Whistler in July. Should I go about booking that trip? What kind of restrictions might be there? If there's a concert at the end of August, should I buy that ticket? Or maybe even students right now looking to go to university and play basketball for the school. I mean, is that something that could be a possibility? What sorts of advice are you giving to people who are trying to make plans for the future when the future is just so unknown right now?
Yeah, that's just it. What I'm saying is, there's going to be a lot of things that we don't know yet. And this is a really challenging year for everybody, for all of us. And I can't foresee everything. I can say that it's unlikely we're going to have concerts. I do not see, or major, big events. I do not see lifting the order on mass gatherings for under 50 people in the near future. Those types of events we know are risky. We know that we've had lots of cases associated with, if we look around the world, with large events like concerts, like sporting events, conferences. So those types of things are not going to happen this summer. We have to be aware of that. If we're planning weddings, we can still have these events, but we have to think about doing them in a different way right now. Graduation from high school, it's not going to be a big party where everybody gets together, because that's too risky. It means that you might spread this, and if you have all of those contacts, they're going to bring it home to their families and their loved ones. So we need to look at how we do it in a much smaller scale, with those who are close to us, and bring people in remotely to celebrate with us. I have full confidence that universities will be open next year, but it may be more of the virtual model that we saw at the end of this year. So I think we need to think about that for the next year. Things will be different. Things will be different. I mean, if we get really lucky and we have a good effective vaccine that comes before the fall, I just don't think that's going to happen. I think we're in for all of us around the world, and we're seeing this not just here. We're looking at Europe, we're looking at all around the world. We're going to be doing things differently for a year. Doesn't mean that we have to give up everything and that we're going to be in the same place that we are right now. I absolutely think we have some space. We have some space to be able to open things up, to connect with people, but not on those large-scale events. And then, you know, once we get to that point in a year or 18 months or whenever, I'm really looking forward to a really big party. And, you know, we have to remember that we will have that time again.
Okay, so we have time for one more question today. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Rob Buffum, CTV. Go ahead.
Dr. Henry, my question is, we spoke earlier today to the mayor of Alert Bay, who said there's an outbreak on Cormorant Island, and in their community, he said people there are still partying, so they're anticipating bringing in a bylaw with a curfew as well as enacting a local state of emergency. Any non-essential travel. I guess my question is, can you tell us how many people there have contracted COVID-19, and I suppose even more so, how concerned are you about hearing about this?
Yeah, so this is something that we've known about for some time since the cases were identified. And the First Nations Health Authority and Vancouver Island Health Authority have been working very closely with the community to identify people who need to, who may be at risk, who've been exposed, and people who are tested positive. And I know that the testing is ongoing. My understanding is there's somewhere around 6 or 8 people who have tested positive so far in the community, and this is actions that the community is taking to try and prevent transmission within that very close community up there, and we're working to support them in doing that and making sure that people have what they need to self-isolate, that they're able to get the food, the medications they need, and are able to effectively separate in that community.
Okay, that's all the time we have today. Thank you.
Thank you.
Thank you.